Hello, my name is Dr. Bethany Wong and I work at the Stop HF Clinic in St Michael's Hospital, Dublin. I'm going to talk to you today about some of the tests which might be needed to help measure your risk of developing heart failure. Depending on your symptoms and medical history will depend on which tests might be required, so not everyone will have all of these tests performed. Echocardiogram, echo or heart ultrasound. In this test, a small probe is rubbed over your chest and takes pictures by ultrasound of your heart. The tests show how well your heart is working. It shows whether or not you have heart failure or if you are at risk of developing heart failure. An echocardiogram is often done on your first visit to the Stop HF service so that we have a baseline measurement. The scan will be repeated during follow-up visits if your natriuretic peptide blood test indicates that your heart might be under strain. 24-hour blood pressure monitor. Controlling blood pressure is an important aspect of heart failure prevention, especially where the natriuretic peptide blood test indicates strain on the heart. Therefore, if your blood pressure is too high or too low, we will ask you to wear a blood pressure monitor over a 24-hour period. This includes while you move around, live your normal daily life, and whilst you are sleeping. It uses a small digital blood pressure machine that is attached to the belt around your body and which is connected to a cuff around your upper arm. ECG, Electrocardiogram. An ECG is a test in which small electrodes or stickers are placed around your chest and limbs and attached to an ECG machine. This machine records the electrical activity within your heart and it can show if you have an abnormal heart rhythm or damage to the heart muscle. Holter Monitor. If we suspect the rhythm of your heartbeat is abnormal, we will ask you to wear a device called a Holter Monitor for a few days. This device records all of your heartbeats. This test is similar to an ECG, but it gives us more information about your heart rhythm over a longer period of time so that we can identify abnormalities occurring less frequently. Exercise stress test. A stress test usually involves walking on a treadmill to see how your heart works during physical activity. Because exercise makes your heart pump harder and faster, an exercise stress test can reveal problems with blood flow within your heart. Cardiac MRI. A cardiac MRI is another way to assess the structure and function of your heart when the echocardiogram cannot provide adequate pictures. An MRI involves entering a hollow tube, like a tunnel, for about 30 minutes. If you get panicky in tight spaces, tell your doctor or nurse, as you might find this test difficult to do. Coronary Angiogram. This test may be required if there is a suspicion from your symptoms or tests, especially the stress test, that there may be a problem with the blood supply to your heart. An angiogram is a medical procedure that is done in hospital as a day case. You may be given some medication just before the procedure to help you relax. Using local anaesthetic, a small tube or catheter will be inserted into your wrist or groin and threaded up to your heart through your blood vessels. We inject a small amount of dye to show any blockages of the blood vessels that supply the heart. Please note, the Stop HF service is concerned with managing your risk of developing heart failure. Your GP is responsible for managing your general heart health.